All right, so continuing our series of things I say about 100 times a week. Our last video was flossing review, or flossing for beginners. This is a review of flossing for advanced flossers. I want to talk a little bit more about some of the details of flossing that we didn't get to share in the first video. Patients who floss, the fact is, statistically live longer. Flossing your teeth is one of the things that you can do to make yourself healthier. The same way that exercise, drinking more water, minimizing stress, all those things help you live a long and healthy life. Flossing's in the top 5. So if you want to be as healthy as you can be, it's something that's very important to incorporate into your daily routine. What you're doing when you remove the plaque from in between your teeth is you're not only making your teeth healthier, but that plaque and bacteria gets into your bloodstream. And we're just now really learning in the last few years some of the effects that plaque can have on the rest of your body, including a close relationship with heart disease. So flossing your teeth will decrease some of the, we call them comorbidity factors. In other words, decrease your risks of dying from heart disease. When you remove plaque from your teeth, you're also interrupting the process of tartar or calculus buildup on your teeth. The bacteria that's in plaque, and this may be oversimplifying it a little bit, but this is how I explain it to my patients and just an easy way to think about what happens. When plaque sits on your teeth for longer than 24 hours, that bacteria is really active in there. And it goes, oh, we can stay. And it starts to build a house. And it builds a house around itself that's really, really hard. And it sticks to the tooth, just like a barnacle sticks to the bottom of a boat. And the only way you can get a barnacle off then is to scrape it off. You can't just brush it off. It's just stuck too hard. Well, that shell, that house that bacteria creates is called tartar or calculus. Same thing, just one's the TV word for it and one's the dental term for it. And once that tartar or calculus is attached to the tooth and the root of the tooth sometimes, it needs to be removed by a hygienist. And so interrupting that process by flossing at least once every 24 hours is super healthy. Once that barnacle is stuck to the surface of the tooth, that's when you start to get an additional process of inflammation, damage to the tissue around the tooth, and even worse, damage to the bone around the tooth. And that's how you get bone loss going down the socket of the tooth. And as I mentioned in the first video on flossing, more adults will lose their teeth to this process than to cavities. So interrupting that process of gum disease and inflammation and bacteria buildup and then subsequent bone loss is very important if you want to keep your teeth for the rest of your life. Now, getting back to being healthy, if you keep your teeth, how much nicer will our twilight years be if we have all of our teeth? I think you could argue that you'll be happier and healthier for that. When patients floss, some problems that come up and some things that I hear is, gosh, every time I floss, my gums just ache, my gums hurt afterwards. If you haven't been a regular flosser, it's exactly the same as not being a regular weightlifter. The first couple times you do it, you're gonna feel it. So just like with lifting weights, take it easy, be a little bit gentle, ease into it. Because that throbby, achy feeling that you're feeling is exactly the same as your sore muscles the next day after a hard workout when you haven't been on the horse for a while. Make sure you're using proper technique. When you go down in between the teeth to floss, it's important to remember that you're cleaning the surfaces of the teeth. You're not wanting to snap your floss in between and cut the piece of gums called the papilla between the teeth. I see patients the first time they start flossing, or sometimes patients don't floss for a while and then maybe do it just a day or two before they're cleaning. They might be very aggressive, and when you snap between and go right up into the gums, you can actually cut and split that papilla into 2 pieces. And if there's a lot of bacteria in that area, it gets into that little cut and you get a little localized infection, and it can be very sore. So make sure when you go down to floss that you remember that you're pulling towards one tooth and scraping that tooth, then come up a little bit and then pull towards the other side and scrape there. You really don't need to snap into the gums in between the teeth. I also want to talk about, if you haven't watched the first video, go back and watch flossing number 1, or flossing for beginners. Because one of the things we talked about was the suggestion from one of my patients of, after flossing, sniffing the floss to see how bad it smells and to see if you've been effective enough in cleaning your teeth. I just want to point out that if you can smell an odor on your floss after you've flossed, then there's a really high chance that other people are smelling that odor coming from you when you're speaking to them. So when have patients who are worried about bad breath or halitosis, bacteria in between the teeth is one place that odor can be coming from. And we'll be talking in a little bit about cleaning your tongue, because that's a spot that another spot that the odor can come from. And then later we'll be talking about tonsils and adenoids and problems back in the throat area that can also cause odors. And then later we'll be talking about reflux issues and stomach odors. But right now, focusing back on flossing, sometimes you don't know that you have a bad breath problem. And so giving a little quick sniff of your floss will help you to be able to recognize your own odor that maybe other people are just being too polite and not telling you. Another benefit of flossing is that when you do this and remove the plaques level, the plaque from in between your teeth, just like when you brush, it will also help to decrease staining on your teeth and make your teeth appear whiter. They will be whiter. So another strong argument for doing it. And then the last thing I want to mention that we didn't have a chance to, actually there's two more things. When you're flossing on technique, it's important as you're slipping up on the teeth to go up between the gums and the tooth. Sometimes people don't go deep enough. You can't go all the way up to your nose, or all the way down to your chin. It'll stop itself. But right up to where you feel that stop, you want to clean all the way up in there. If you imagine the tooth to have a cuff of gums around it, you want the floss to go up under there until the point where it attaches. Okay? And then patients often ask, should I floss before or after I brush my teeth? And you know what? It really doesn't matter. I prefer to brush, clean my tongue, do my mouthwash, floss, and then I finish with the Hydro Floss. Now, I'm a dentist, so clearly I might be going a little bit overboard. But I do have a system with that, and I just really love flossing my teeth, putting my hands in my mouth when I feel like my mouth has already been kind of cleaned overall. So, I think that's all for flossing part 2. Watch for the next couple videos in the series, continuing with the breath question.